Caroline Thomas, who's the founder of Peduli Hati Bangsa Foundation in Indonesia, who recorded some remarks for us. She's actually live on the line, but recorded some remarks. And we'll be listening to this. Just to tell you to turn up the volume on your computer just a bit so that you can hear. The video is a little bit faint, so just turn up the volume as much as possible. And thank you so much, Caroline, for preparing this video for us. If you do have to drop off after the video and the poll, we understand. We will bring the speakers back for a moment for those who can stay and close out with a question or two for them. Thank you so much.
Hello, my name is Caroline. A little bit background about myself. I am a woman living with HIV, with 2 children, and also a partner of person living with both hepatitis B and C. Today I will share a little bit about my experience and also other experiences in accessing pregnancy services. So several years ago, I had a very ideal situation whereby the time I was pregnant, I was already on ARV treatment for 7 years and my HIV viral load was undetected. And on top of that, I was fully vaccinated against hepatitis B. I happen to live in Jakarta where health services and better healthcare is available. I also happen to consult to a gynecologist who are very supportive and also very communicative throughout my pregnancies. I have 2 pregnancies. We make decisions together about the treatment, mode of delivery, and also decisions for infant feeding. And as for the treatment, I was using efavirenz for the first time. There was some concerns about the safety use of efavirenz during pregnancy. At the same time, I was aware of the risk of developing severe rash due to the use of nevirapine with higher CD4 cell count. At that time, the data shows that there is a teratogenic risk which can cause neural tube defects to the infant. So after discussing with the doctor, we then decided to switch efavirenz to nevirapine temporarily. What happens after around 10 days of switching the treatment is that I develop rash. And this is the actual photo that shows the first sign of rash. And on the second day, it got worse. And on the third day, I was practically swollen. I went back to consult with my doctor, and mind you that this was way back in 2011 where treatment option was very limited, and WHO has not changed the recommendation for the use of efavirenz during pregnancy. But the doctor was willing to look further for the data, and he found an ongoing meta-analysis that shows the use of efavirenz during pregnancy does not increase the risk of NTD. So after that, we decided to switch back to efavirenz. I gave birth and my baby was very healthy. During the delivery, the pediatrician was also very kind and she was willing to communicate with me even though I was still shivering from the epidural. And I remember that she whispered, "It's okay, everything is well taken care of. I have given the prophylaxis to your baby and we will continue to monitor him and her." I will always remember those kind gestures from the doctor and also the pediatrician. So the whole experience of giving birth to 2 healthy children had motivated me to become a better educator. Flash forward 2017, my husband needed a treatment for his hepatitis C. In 2017, a full combination of DAA is not available yet in Indonesia, and we realized that there are so many people in need of access to hepatitis C information and treatment. Later on, we established a foundation, and since then we met so many people, including pregnant women living with HIV. We have met one young woman living with hepatitis C and also a victim of intimate partner violence. She was 8.5 months pregnant when her partner pushed her down the stairs and her water broke. At the hospital, she was told that she needs to buy her own disinfectant. 2 gallons of it actually, because the hospital has a certain limit for the use of disinfectant. She carried the 2 gallons of disinfectant while having contraction, and she was still in shock because she was pushed down the stairs, all because she had a hepatitis C. So this was really bad. Another case last year that we assisted was that this mother was a person living with hepatitis C, a former drug user with a 10-year-old girl. The child was diagnosed 10 years ago because the mother wanted to insure the umbilical cord, but it was rejected because anti-HCV was found to be positive in the umbilical cord. So the mother then also get tested herself, and she found out that she was also positive for hepatitis C. When she reached out to us in our Instagram, she was worried about her daughter because she was not aware of the DAA. She was also a caretaker of her brother, who was also living with hepatitis C and had an experience of using interferon. She cannot accept that her child will go through the side effects of interferon. This was the only treatment option that she knows. So interferon was the only treatment option that she knows. That's why she was not looking for information, but later it becomes a burden for her. She feels that she is neglecting the child's right for treatment if she did not find information for the child. When she reached out to us, we explained that there are newer medications with lesser side effects and higher cure rate. And it is possible that it is the result of the antibody of the mother that had been passed to the baby, and also there is a possibility for the spontaneous clearance for the child. At this point, we had successfully advocated for free hepatitis C services in Indonesia, including viral load and DAA. So everything is available. We then accompanied her and her daughter to get the confirmatory test. Her husband also get tested for anti-HCV. It came back as negative. And to her surprise, the confirmatory HCV viral load test for her kid shows that it is undetected. You can imagine the 10-year burden is finally off her shoulder. She was so happy. So although the mother's viral load is detected, she was so happy that the child does not have hepatitis C. She decided then to get her own treatment, and now she had reached SVR12. From the whole experience, I can recommend that research or analysis for hepatitis C treatment among pregnant women should be available. Other than that, most stigma and discrimination that happened with the two ladies happened because of the lack of knowledge and also understanding about hepatitis C among healthcare workers. So from our experience, stigma in the healthcare could prevent someone from accessing care. So educating ourselves is the first step for a better information relayed to others. Also, we have to put in mind that as physicians or community educators, we have an impact in someone's life. So building an empathic relationship can lead to better outcomes for the patients. So it is very, very important. Thank you so much for the opportunity for me to share.